Hello and welcome to the Winter Park Chamber virtual webinar series. We are thrilled to continue offering ways for you to connect and learn through virtual programming. My name is Amy Morgan and I am the Associate Vice President of Programs for the Winter Park Chamber. If you're watching us live on Zoom, I invite you to introduce yourself and say hi in the chat box. You can find that by hovering on the bottom of your screen, clicking chat and introducing yourself. You're also welcome to give us an update on what's going on with you and your business. We encourage you to take this opportunity to do a little bit of virtual networking while we have this opportunity today. If you're watching us live on Facebook, you are welcome to drop a question or a comment in the Facebook comments. This recording will be housed on our website at winterpark.org for you to review at a later date or share with a colleague. Let's go ahead and get started. I would like to introduce you to Betsy Gardner-Eckford, President and CEO of the Winter Park Chamber. Welcome, Betsy. Betsy, are you able to turn on your video? I think we're running into a little bit of a technical difficulty here. While Betsy's getting up and running, I do encourage you to share what's going on with you and your business in the chat box if you're watching live on Zoom. We'd love to know, are you open? Do you have restricted hours? Are you working from home? Let us know what is going on with you.
Amy, thank you for that introduction. Sorry, we had some computer problems. Technology is great every time it works. I want to welcome you all this afternoon, and clearly from the amount of participants we have on this call, we could see that there's a need to learn from the experts in our midst, and I could not be more delighted to be able to present this content this afternoon. Our mission at the Winter Park Chamber of Commerce is to convene people and ideas for the benefit of both our businesses and our community. And we know this is a difficult time right now where we've got a lot of information, so much so that it's actually hard to figure out what we're supposed to do next. So I am delighted that you're with us today, whether you're joining us on Facebook or through our platform here on Zoom. You are in for a treat. I know from our own perspective, understanding what to do when someone in our household has been exposed to COVID, or if we haven't been, these are challenging decision trees for us to have to pursue right now, because we know that we want to keep our team, our family, our workplaces, and our community safe, but it's not quite as clear as we would all like for it to be to understand what to do next. So I know that you will have more clarity at the end of our webinar today. So it's a pleasure for me to introduce Steve Kramer, who was appointed President and CEO of the Mayflower Retirement Community in August of 2015. Over the past 30 years, Steve has possessed leadership roles in both the healthcare and hospitality industries. Steve completed his MBA with a concentration in healthcare administration at the University of Michigan in 2008. His undergraduate work at Penn State culminated with a Bachelor of Science degree in hotel, restaurant, and institutional management. He has also been certified as a fellow of the American College of Healthcare Executives. Since relocating to Central Florida, along with his wife, Kathy, and his son, Colby, Steve has become a member of the Winter Park Rotary Club, currently serving on its board of directors and as chair of its membership committee, completed the Leadership Winter Park program with its 2018 cohort, and was appointed to the board for Leading Age Florida in 2019. Steve has also become a certified master scuba diver and has completed over 90 dives in the past 3 years. Prior to relocating, Steve was an active member of his previous community, serving on several governing boards for local civic and business organizations, and was vice president for the Wellsboro Area School District Board of Education. Steve, good afternoon. Thank you for being with us.
Good afternoon, Betsy. Thank you, and hello, everyone.
I'm also going to introduce Brian Devine, who's the Director of Nursing at the Mayflower Retirement Community. Brian is a registered nurse and has been the Director of Nursing for the Mayflower since September of 2018. He has worked in long-term care since the age of 16, when he began working as a certified nursing assistant. He has extensive experience in nursing leadership positions in standalone skilled nursing facilities, as well as continuing care retirement communities such as the Mayflower. Recently, he completed specialized training in an infection prevention control officer program through the American Healthcare Association. That just couldn't have come at a better time, Brian. I'm glad to hear that we have that. He's helped the Mayflower's response to the COVID-19 pandemic by developing specific policies and procedures on infection control practices, employee screening guidelines, developing a respiratory protection program for healthcare employees, and developing community-specific protocols on responding to potential COVID-19 infections. Brian was born and raised in Kentucky and moved to Florida in 2000. He lives in Longwood, Florida, but has worked in the Winter Park area for the last 7 years. He is currently enrolled in the Leadership Winter Park program through our own Winter Park Chamber of Commerce. Welcome, Brian. We are thrilled to have you. I have a healthcare background, so I know that any kind of community infection control proposition is a difficult one, whether people are hospitalized, whether they're in a public health setting like college dorms or like any kind of community healthcare setting. Managing infection is a huge challenge, and people have had to do it with respect to tuberculosis and things over the history of humanity. And now we're faced with a highly contagious virus that you all are doing an excellent job so far of managing in a community environment where people are of advanced age who could be more difficult to treat, and for some who have comorbidities with other high-risk diseases. What I hear from your residents is not only are you doing a great job of protecting them, but you're doing a great job of engaging them. So congratulations to both of you for managing what we call the first phase of this extremely well. We've heard nothing but positive comments from your residents who feel that you're doing a great job with that. So can you walk us through a little bit about when the pandemic emerged? We know that you all acted particularly quickly to keep your residents safe and build a community model of infection control. You enacted a plan to do that. What did you first take into consideration when you enacted that plan?
Well, Betsy, if I look back to when this all started, we wanted to get, I think, out as far in front of this as we could at the time. So we tried to act swiftly and decisively. At the very beginning, there was a lot of uncertainty about what this really was and how bad it was going to get. People weren't really taking it very seriously. We made a decision early on that we were going to take it serious, and we were going to do everything we could to, out of an abundance of caution, put things in place that were going to keep our residents and our staff safe. I kind of made a decision that I'd rather be criticized for being overreactive than for not doing enough. So we followed guidelines from medical professionals. We looked at guidelines from the CDC, the Centers for Medicare and Medicaid Services, the Agency for Healthcare Administration, and the Florida Department of Health, as well as mandates and orders from federal, state, and local governments. But our highest priority was really trying to decipher what would be necessary to maintain the highest level of health and well-being for our residents and our staff. So the other thing, which for the Mayflower is kind of difficult, we're well known for providing a high level of service to our residents and for doing whatever we can to make them happy. And we had to acknowledge that as we were making these decisions, we had to focus more on what's the right thing to do and what's in the best interest of the safety of our residents and community, and focus less on what was going to make everyone happy and please them, because many of the things we put in place were considered to be, at least at the time, somewhat draconian, but necessary. And thank goodness we took early action, because it certainly paid off. And as things progressed, many of the things that we put in place initially came to pass that the government put in place across the board. So other than that, we had to think beyond the implementation to what are the long-term ramifications of these restrictive regulations, like the stay-at-home order. What kind of impact was that going to have on residents and our team? And also knowing that, and Floyd, we've really experienced this, and I think we all have, things are going to evolve and change, and they sure did. Every other day, it seemed, we got different guidelines and different advice and different executive orders from different government and regulatory agencies, many of which conflicted each other. So trying to wade through all that, decipher it, and decide how we needed to adjust became very important.
Brian, did you have anything to add to that planning piece? You're on mute at the moment, muted. Brian.
Sorry about that. No, I was saying I think he pretty much covered that pretty well.
Okay, so here's one speaking to your population. So your circumstances are unique, and I would say specialized, with a population over 60 and in some cases much higher. What have you learned about what's working with this population in terms of keeping them safe and engaged?
Well, you have to start by realizing the population that we serve and really the individuals we serve. We have a very vibrant and engaged group of residents. They enjoy their independence. They enjoy being active and involved. They like going down into downtown Winter Park. They go to the theater, they travel, they socialize, and they come and go as they please. So on top of that, we have a pretty strong family atmosphere at the Mayflower. So staff and residents really truly care about each other's well-being. So because of that, the approach of being direct and honest and transparent from the beginning and communicating excessively and letting them know that precautions we were taking were really for everyone's safety and well-being. It resonated with our group. These are well-educated, very respected and important individuals. So at the end of the day, they get it, and they know that we're trying to keep them safe. So we constantly communicated with them. I provided, since the beginning of March, both recorded and written updates to residents on at least a weekly basis, sometimes more than that. And what I think has really worked well is giving them really good data, information about the cases that are happening in Orange County, cases in our zip code, the presence of COVID on the Mayflower campus, all of those things, and just being very upfront about it. And also putting things into context for why it's important. Because, there's certainly people that have a cavalier attitude about it. They don't really think it's a problem for them, or, well, if something happens to me, I've lived a good life kind of attitude. So letting them know and helping them realize that their choices impact everyone around them. A couple of sayings that I'd like to use around the Mayflower is, is the risk worth the reward, and make good choices. So the last thing I'd say in that is reminding residents and our staff really that this is uncharted territory. COVID didn't come with a user manual, so we're in it together. We're adjusting, enhancing, we're learning as we go, and trying to do the best we can to have reasonable precautions in place, but at the end of the day, that we're doing the right thing to keep people safe.
I love that phrase, COVID didn't come with a user manual. I think that we're looking to you all to help us with our user manuals, because you've been doing this a little bit longer than the rest of us. And you have had to have more of a lockdown mentality than some of us have, maybe a little bit longer. So you definitely have more days in the game than we do in terms of decision making. Can you give us some specifics about how you've kept your residents engaged, busy, and safe? I think that's been one of your greatest successes, is your approach would probably likely resonate with other age demographics. Tell us how you all have approached some of those methodologies with accepting that we don't want people coming and going per se, but we still have to live our lives and stay engaged with our families, with each other. And I know you've got a lot of lifelong learners at the Mayflower. What are some of the things that you all have been doing that we can benefit from, to learn from that sense of, yes, we're a little bit on the isolation or the lockdown stage, but we want to keep everything moving along in terms of learning and growing?
Right. Well, I think, the safety measure side of things, what we've done here probably isn't a lot different than what should have been done in the general community, and was recommended to be done. I think we just started it earlier and we enforced it more, but encouraging residents not to leave campus and stay at home, practicing social distancing, mask wearing, enhancing our sanitation procedures. Everyone who enters the building, staff, visitors, whomever, is screened. And we certainly have conducted various levels of testing throughout the community. We closed our dining room, we stopped activities, we closed our fitness center, our pool, our beauty shop, basically any common area that, that could potentially propose a risk to our residents, we stopped using. Early on, we began offering delivered meal service to residents in their homes at no additional cost rather than having them come to the dining room. We implemented Instacart and Shipt services through our lifestyles department to do resident grocery shopping for them. We went to the pharmacy and picked up prescriptions. And all non-essential visitors were not permitted to enter the campus or the building. So that started early, and very many of those things are still in place today. As far as keeping residents busy and engaged, it was a challenge, especially at first due to all the restrictions. But there's several things that we were able to get in place. If I can narrow it down to a very simple answer, alcohol. Alcohol works really, really well. But all kidding aside, we did give out a lot of alcohol to residents over these past few months, and they're pretty happy about that. But for every demographic, especially this one, technology sometimes is a major factor. We've been helping residents stay connected with their family and friends and neighbors with FaceTime, Zoom, Skype. We have on-site IT support, and they've been spending a lot of time going and assisting residents with learning how to use these technologies. We actually threw some virtual birthday parties for some of our residents. One in particular turned 100 and another turned 109. The staff threw them both virtual parties via Zoom with members of their family. Our 109-year-old actually also was able to have audio and video from members of Opera Orlando singing happy birthday to her. So that was a real thrill. And our residents have been really involved as well in staying engaged. Early on, a number of the ladies in our sewing group made masks for frontline workers. We've established a weekend writers group. So they share their experiences during COVID through journaling and creative writing. And then, our staff has really gone above and beyond in trying to be creative and resourceful to provide entertainment and activities to residents while they're confined for the most part to their rooms. So, our marketing and our lifestyles department collaborated quite a bit. At Easter time, they dressed up as the Easter Bunny and delivered eggs to the residents' rooms. They've delivered ice cream to residents. Sometimes they just pick up the phone to give them a call. But all of our staff have been heroes throughout this. Our fitness coordinator, Sarah Burke, actually recorded an exercise DVD for residents, and we sent that to their apartments so that they could do their chair exercises right there at home. And we've had daily theme activities, and they all involve a delivery to the resident's door. And that could be anything from a make-at-home cocktail to freshly baked cookies to origami projects. So there's been a lot going on around the Mayflower. And in the last few weeks, we have, with limited access and, of course, appropriate social distancing and mask wearing, reopened our library and our billiards room and our pool and our fitness center, but all with a lot of restrictions in place to manage that.
Well, and I love this because when reading your bio, I realized that you're having to draw on both your healthcare backgrounds and your hospitality backgrounds, especially at a time like this. You're basically part cruise director, part chief health officer. So we're lucky to have that expertise. I also want to know, is there any link between the alcohol consumption and the longevity where you live past 100? Hopefully that's a good idea. Maybe Brian, you can support that to justify some of my evening wine consumption. But if you're building your COVID manual, put alcohol at the top. I like that a lot. Tiffany's got a slide for us she's going to put up, which actually we'll put in a link to this presentation. And it's understanding your risk during COVID, and it's got some activities listed there. This now sits on the fridge at our house so that my older teenage children can understand where we want to be. We want to be in that green and blue area. But Brian, I know if you want to walk us through some of the things that you found are more resonant with your residents, or if there's any comments you have on this list. I think it just helps, I think, as we all need more specifics about how to stay safe. I think everyone's a little worn out and tired of the whole home quarantine situation, but we still have to be quite careful. So we're trying to get these tools into the hands of our community so we can be a responsible community, and we can help look after each other, but still find ways to, you know, enjoy our lives. Did you have any anecdotes, Brian, of what's working well for you? I love the delivered cookies and the cocktail of the day. It just sounds like a really fun place to live. Do you guys have a space for me to sign up right now to live there? Sounds great.
Well, just commenting on this list right here, you know, the high risk categories, you know, this is all about cross-contamination and person-to-person contact. So of course, you know, everything in that high risk is, you know, eating at a buffet, bad idea. I mean, working out at the gym, you know, depending on the gym, I mean, you've seen on the news, some are very good about, you know, the number of people they're letting in, and other ones are not following the rules. So you kind of have to, you know, pick and choose where you want to go. So if you go up the list, it's more and more about, you know, more and more social distancing, less contact. You know, as the CDC has let us know, it's more of, you know, you're not going to get it from, you know, picking up from a to-go box or a surface. Then it's more about person-to-person contact. So are people social distancing? Are they wearing masks? Are you far apart? So, you know, all these activities correlate to that perfectly.
Great. What high-risk behaviors are you seeing? I'm sure you're not seeing them at the Mayflower, but are there high-risk behaviors you're seeing as you go about your personal life, Publix, anything like that? What are you seeing or hearing that concerns you as an infection control officer of a community like this?
People not wearing their mask correctly, you know, is one of the pet peeves. You know, it doesn't help you if your nose is sticking out. So that's one of them. You know, not really adhering to social distancing, and, you know, you see people going out and having large group gatherings. You know, from you know, what we've seen is any level of exposure, you know, creates a domino effect. So, you know, if you didn't do what you were supposed to be doing, and then 3 people next to you didn't do what they were supposed to be doing, and then the next people that they're in contact with, and you're taking it home to your loved ones, it just spirals out of control very quickly. So the things that are, you know, an annoyance or an inconvenience to you, you know, really plays a factor of, you know, knocking that next domino over because you didn't do what you were supposed to do. So that's the biggest high risk behavior. And just people, you know, hand washing is a big deal. And, you know, the other pet peeve that I can just see out in the community is people don't understand cross-contamination. Wearing gloves is not the best idea, because what you do is you touch everything and you touch everything around you and you think you're good, but you're actually cross-contaminating more if you just wash your hands or use hand sanitizer instead of that. And, you know, those are my 2 big takeaways from out in the community.
Okay, so gloves, no, and mask over your nose, yes, right?
Yeah.
Do you have a mask handy, Brian? You want to show us how to put on and off a mask? I know we've had that demonstrated, but it might be helpful to have it one more time.
All
So
right.
take us through this, Brian.
So you want to make sure it's over your nose. It's you know, fitted to your face. And when you're taking it off, don't touch your mask. And if you're storing it, you're supposed to store it with the inside like this, basically. So keep it in your car. You know, right now masks are not everywhere. A lot of people are reusing them, which is okay. But, you know, trying not to touch your mask with your hands. And if you do, you have to you know, act like the outside of your mask is dirty, so immediately to sanitize your hands.
Okay, that's really helpful. All right, so you guys this is great. You're helping us frame some of this, and we've got some tactical questions now, so we're gonna go to the speed round, okay? So, so how long do you quarantine if you yourself have been exposed to someone with COVID-19, and what other steps should you take?
So quarantining is 14 days from that date of initial exposure. So as far as the steps you should take, is, of course, you should be staying home. You should be isolating from others in your household. Monitor for signs and symptoms. Check your temperature twice daily. Signs and symptoms is fever, cough, shortness of breath, loss of taste, smell, body aches, chills, diarrhea, nausea, vomiting, congestion, runny nose, and headache. And this list keeps growing. So, keep checking the CDC guidelines. You see things, all the time on Facebook and other things that are not as so reputable. I think Steve kind of mentioned it before is, don't look at things on Facebook. Look to your CDC guidelines, WHO, World Health Organization. These are the experts, not somebody that used to know something on Facebook. So paying attention to new onset of worsening onset of symptoms instead of chronic symptoms as well. So people can, be in that paranoia, oh, I've got a cough. Well, you've always had a cough. I'm a little bit short of breath. Is this your normal, shortness of breath because you have asthma? So it is that increase of condition or change to something you haven't experienced before. So if you're alone, keep in touch with family and friends so that you get needed items to you without breaking quarantine. If you have to be around others, ensure that you have a mask and keep social distancing at all times.
Okay, so let's go through this. You said 14 days from date of exposure. What if I don't know what my exposure was? So I'm going to take my symptoms maybe, and then I'm going to go get tested. So I have a symptom onset. So how many days from the date of symptoms then, if I'm not sure about what my exposure was? Still 14 days probably to be safe?
Your 14 days would be the date of onset of symptoms because you don't know when your exposure was.
Okay.
So, you can get that negative test result back. If you don't have any known exposure, at that point, if your symptoms go away, you're basically, you've ruled out that you have COVID-19. But with known exposure, the 14-day is very critical. And a lot of people, get this mixed up because I get a negative test result, I'm fine. Well, no, you're not. The 14-day is because it takes from 2 to 14 days, depending on everybody's physiology is different. You're going to incubate the virus within 2 to 14 days. The majority of people are doing it within 5 to 7 days. But just because you test negative on day 7 doesn't mean you might test positive on day 11 and now I'm off quarantine and I'm infecting other people.
Right. And then we also have a slide, if Tiffany, you'll put that up. We wanted to give everybody some clarity on the difference between quarantine and isolation. Brian, can you speak to that? This is from the CDC, so it's really specific, and we're going to put it on as our show notes that you can click on and use in your offices as a quick and dirty guide to what to do. Because I know for us, we have people in our office who may not have it themselves, but somebody in their household does. So we want to go through a really clear protocol of what that looks like. How do we keep people safe?
Yeah, so quarantine just means you had contact. It doesn't mean that you're gonna develop COVID-19. It means you've had close contact, and just the definition of what close contact is, that is 10 minutes or more of close exposure without a mask or without social distancing. So brief encounters aren't really considered close contact. So passing through, barely going by someone doesn't really count. So the staying at home of 14 days, you're monitoring for the symptoms, you're checking your temperature twice a day, and you're trying to stay away from people as much as possible. So isolation means you do have COVID-19, you need to stay, in a room away from other members of your family. As far as, what we go by, it's not 14 days once you test positive. There's different approaches, but what we go by is the golden standard of 2 negative test results within a 24-hour period. So that means you don't have to have 2 tests right away within 24 hours. And right now that's very hard to do because getting test results back, with that amount of time is very hard to get. So what that means is there has to be at least 24 hours between the 2 tests that you took. And then once you test negative twice, then you're free of the virus basically. Because if you go by other, the CDC has other guidelines, but they even say that, this is a guideline only. It doesn't mean that you couldn't still be shedding virus or that you still couldn't infect others. So we really try to stick to the golden standard. If somebody tests positive, you have to test negative twice and be aware that that can go well outside of the 14-day range because some people it takes days and weeks to clear the virus from their system.
And I think what's clear that we need to make clear is that even if you've tested positive without symptoms, you still need to have those 2 negative tests to be green for go, right, Brian?
Correct,
Okay.
because you could be asymptomatic. It does not mean that you're not shedding the virus and that you're not contagious. So, you know, you're a vector of the virus. You could be walking around feeling fine and you want to go outside, but then you're making those other people that have all the comorbidities sick. And that person might end up in the ICU even though that you feel fine.
Right. Are there other things you want to tell us about quarantining or any other safety measures that you all are implementing or suggest that we implement in our own communities?
As far as quarantining, I think I hit the best parts. As far as, you know, if you have a worker, I think that was the next question. If you haven't been exposed or been around with someone with COVID-19, you know, if you have secondhand exposure, it gets kind of a little bit trickier. You know, and everybody in a business, you know, you could be an essential worker per se. So that's up to everybody to decide who is essential and who is not. Now, healthcare workers, we have our own pretty much algorithm of, you know, what to do when you're an essential worker. So, you know, if you're a business and you're an essential service and you think you have secondhand exposure, you can still work, but that I would, you know, recommend being in contact with the Department of Health and having that conversation and getting direct, you know, instructions. And they're going to tell you, well, you know, make sure you're asymptomatic and that, you know, you are taking your temperature, that you're doing the proper screening, and that you're wearing a mask because, you know, again, the mask is source control. It's to protect others from you at that point. So that is all a decision that you would make, you know, as a business with, you know, the Department of Health at the same time. If you're not essential, you need to be doing the same type of quarantine as everybody else. You know, it's just better safe than sorry.
Right. And in thinking about just kind of wrapping up, do you have any other best practices either through protecting or engaging your residents that we might think about as we go forward? These are all really helpful and very clear guidance points for us to be thinking about as we start thinking about moving back into our offices, workplaces, etc.
Well, you know, everybody knows wearing the face mask, hand hygiene, social distancing, you know, as a business, that should be consistent. Practice at all times. You know, watch your staff, watch what they're doing. You know, if they're not wearing their face mask right, or if they're not, you know, sanitizing their hands correctly, you know, catch them every time and, you know, kind of create a culture of, you know, calling each other out, basically. You know, it is on everybody, not just, you know, you as a supervisor, you as a manager to kind of enforce it with each other. Because any slip up, you know, can cause an issue or a problem. You know, ensure that you have a clear communication of your sick policy. You know, if you're sick, don't come to work. Don't expose others. You know, don't come to work and then be like, well, I'm not feeling well and I've got a, you know, sore throat and a headache. Well, you shouldn't have come in here in the first place. So, you know, make sure that your workers know that, you know, calling in is not going to be punitive, especially during this time, that, you know, you don't want that to spread to your other workers, you know, potentially shut down your business or spread to, you know, customers. So that is a big deal. Ensure you look for risk in your workplace. You know, if you have break rooms, you know, how many people do you need to have in that area? So you can ensure that you can have social distancing. You know, water coolers, is that a good idea right now? If you have elevators, do you need to have, you know, a sign posted, you know, with how many people should be in that elevator? Bathrooms, anything like that, anything that you see as a risk, make sure that you are looking at that and then making protocols, because it's all specific to your business and your site and your work area, because everybody's work area is different. And then stick to quarantining staff when possible, even with secondhand exposure, like I said before. When the virus has an opportunity to spread, once it's in, the domino effect, you know, it can't be really stopped quickly, and it can, you know, prove really costly to your business and to your customers.
Okay, we have a couple of questions from the audience, and one of which is this is a pretty typical question that we hear. I have a situation where a coworker was visiting her parents during the 4th of July holiday on Monday. Her parents tested positive with COVID-19. Do I need to quarantine or get tested because I was around her for a short time on Monday? And I guess that would depend on what we define as a short time, because I heard you say 10 minutes, Brian.
Yeah. Did you social distance? Did you have a face mask on? You know, was it longer than 10 minutes? If you can't answer those questions, then it would be yes, you would need to quarantine.
Right. And then we had one other question about the medical privacy of the COVID positive patients. I know for many employers, they have to disclose to their staff that there was someone in the office that had COVID, but they're not to be disclosing who that person is. Is that consistent with your policies and procedures at the Mayflower as well?
So, you know, that's all on a case by case basis. So with us, you know, we have to protect, you know, our residents and, you know, potentially being exposed to a staff member that was exposed. So, you know, contact tracing sometimes involves having to know, did you have direct contact with this person or not? So, you know, I think that's all on a case by case basis. And, you know, on a legal answer with that, you know, we're looking at health being above, you know, that supersedes in our setting, because, you know, if I'm looking at a health center resident, you know, having potential exposure and we have to do that contact tracing, we have to know exactly who had contact with who. So that's all, you know, a little bit different, and you would probably want to look at your own practice and your own company about, you know, what you're at risk for. I hope that answers your question.
I think it does. We did get a lovely question here to share with you. Please ask the Mayflower team how family members can best support and maintain a relationship with those residents living in the health center. And also, how can we support you and your team, Steve? It's clear that you're doing the yeoman's load of lifting over there in our community and certainly community health. How can we support you? Thank you for all the work that you all are doing.
I think that, you know, for residents, family members that, you know, haven't seen their, you know, physically been in contact with their loved one for quite some time, it's been really hard for everyone. You know, in our healthcare areas, that's really a state federal mandate that we can't allow visitation. And they've had all kinds of creative ways to have virtual visits, but we all know that over time that's not the same. But I think the best support that people can offer is respect everyone that lives here at the Mayflower and stay away. Don't come. It's really in everyone's best interest, because even though we may convince ourselves that we are fine, I've been isolated at home, I haven't been around anybody, there's no risk. There's been plenty of examples where that didn't turn out to be the case. So the best thing to do is to be responsible for everyone and do your best to keep the distance. You know, we are not allowing visitors on campus, but people get creative. You know, they find ways to get around the rules. So there's a strong desire on the part of residents to see people and interact. And so I'd ask, just don't give them the temptation. Now that's, you know, for independent living residents who have a better ability of doing that because they have a freer lifestyle, it's that much more challenging for us to control. So that help would be really appreciated.
Anything to add to that, Brian?
No, I think he hit everything right there. I mean, for us, it's hard right now with not allowing, you know, family to visit, you know, just knowing that it is the best thing. We have to have hard conversations with family members right now, you know, and making sure that, you know, we are providing the avenues of Zoom calls and FaceTime calls and making sure that they can see them as much as possible. But, you know, it's hard right now, but that is the best thing for us in our vulnerable population, because, you know, anything that's coming in from the outside, we're doing everything that we can right now to keep it out. So that help is really what we need.
Well, I can't think of a more qualified team to support the most vulnerable people in our community. And I thank you both so much for the time and expertise you've shared with us here today. This presentation will be on the Winter Park Chamber of Commerce Facebook page. So if you like what you heard here today, and I think we heard alcohol is a key to surviving this. Thank you for the sense of humor, Steve. And really so grateful to have your leadership and expertise. Thank you, gentlemen, so much. Do you have any parting thoughts that we haven't covered that we need to make sure we've covered to people? Because I know this is very valuable content for our community.
No, I think that the best advice is, whether you are doubting the realities of COVID-19 and where it came from and how it's working and is it overblown, it's a serious threat, and it's specifically a serious threat to our older population and our most vulnerable people. So even if it's not for yourself, do the restrictions, do the social distancing, do the mask wearing for others. We're one community, and we need to rise up and take care of everyone.
Anything to add to that, Brian?
Just that, the guidance is ever changing. It is very important to self-educate yourself instead of listening, from, what somebody else may be telling you. Going to reputable sources, the CDC, the WHO. It's very important to get yourself educated with the correct information. And if you question something, look it up yourself. And don't just, take anything for granted that, if that might be the case or something's changed. It's always, important to self-educate yourself.
Well, and you touched on a key point. I think there's water everywhere, but not a drop to drink. There's so much information, it's hard to wade through all of it. And so what you all have done here today is particularly valuable. On behalf of the Chamber, I'd like to thank you both for your time and expertise. And you can see how fortunate we are to have the Mayflower leading the way in our community. To follow up, we have some content that we are driving tomorrow morning at 10 a.m. We're going to be hearing from Joshua Vickery, who's the Executive Director of Central Florida Community Arts. That's 10 a.m. And to join us, either find us Facebook Live at the Winter Park Chamber Facebook page, or find us at winterpark.org to register to participate in that via Zoom. Monday at noon, we're having our Winter Park Professional Women, and we'll be hearing from Susan Johnson, who's the founder and president of Support Our Scholars. Our Hot Seat Academy will be on July 15th, and we're going to hear from the owner and founder of Natalie's Juice, Mary Grace Sexton, and that will be at 4 p.m. July 15th. And then we have our virtual political mingle, where you can meet and understand more about the candidates. Yes, we are having an election in the midst of all of this, and that will take place in August. So if you need help getting clarity about how to mark your ballot, please join us for the Political Mingle, July 29th at 6 p.m., sponsored by Charter Spectrum and UCF. The registration fee is $5, and that will be available at winterpark.org. Thank you so much for being with us this afternoon. And again, huge thanks to the team at the Mayflower and our dear friend Steve Kramer, CEO, and Brian Devine, Director of Nursing. Again, gentlemen, many thanks. You all enjoy your afternoon.
Thank you.
Thank you.